Hi, welcome to Study Nursing, specifically ATI's edition 10.0, Maternal Newborn Nursing. I'm going to begin by reviewing Chapter 1, combing through all the information to give you a summary of the most important points. Sometimes I'll be referring to you as if you were the patient. This is just for some perspective, okay? This is not medical advice. All right. So let's begin with Chapter 1, Contraception. Contraception's purpose is to avoid pregnancy. Keep in mind the egg cannot be fertilized after 24 hours of a woman's ovulation. So that's 12 to 24 hour period is key to know to either becoming pregnant or avoiding pregnancy. Ways to prevent pregnancy include surgery, placing something in the uterus, hormones, blocking the path of barrier, and natural ways. Okay, we're still on page 3, and at the top of the right we have abstinence. We all know what this means, right? Yes. Next we have withdrawal or interrupting. It's an interruption in the process, coitus interruptus. This is when the man removes his penis. Okay, turning to page 4, keeping a calendar. We have to know that a woman has her menstrual cycle. Then count 2 weeks back. That's it. That's all. Just count 2 weeks back from the anticipated cycle. That's prime time for ovulation, so the woman would avoid that time. Moving on to the body temperature. It drops a bit at ovulation time. Then it's on to checking that mucus. Does it stretch? Is it sticky? That's spin Barkeet's sign. You spin my head right round like a record baby. So spin Barkeet's sign. It's sticky. Okay, barriers, blocking that stuff. We all know what a male condom is, right? Yes. Remember, only water-soluble lubricants are used with latex. There's a question about that on page 9. Female condoms next. It's disposable and the closed end is put in before intercourse. Straightforward enough. Diaphragms and spermicide. Easy peasy, right? Wrong. Remember this. It needs to be replaced every 2 years, right? Yes, every 2 years replace that diaphragm. Also, if you're popping those donuts and gaining weight, replace the diaphragm. Pelvic surgery, replace the diaphragm. After giving birth, replace. With the diaphragm, put it in, take it out after 6 hours. Having sex with diaphragm in, 6 hours. Pee first before insertion also, and wash it with soap, please. Wash with soap. Please remember to take the diaphragm out after 6 hours. You don't want toxic shock syndrome. TSS looks like a fever, low blood pressure, diarrhea, and achy feelings all over. Next is capping the cervix, a cervical cap. This and the diaphragm should be used with spermicide. Okay, again, leave it in for 6 hours afterwards. Replace every 2 years and for the same reasons it was given for the diaphragm. Okay, the sponge. It's polyurethane and it has spermicide in it. Leave it in for 6 hours after the action. Getting into hormones. Alrighty, we're talking about the stopping ovulation. Adverse effects of hormones include, get ready, pain in the chest, short of breath, leg pain, clots, headache, eye problems, stroke, nausea, breast tenderness, breakthrough bleeding, fluid retention, hunger, tiredness, depression, and hypertension. There's a question about that on page 9. One more time. Chest pain, shortness of breath, leg pain, clots, headache, eye problems, stroke, nausea, breast tenderness, breakthrough bleeding, fluid retention, hunger, tiredness, depression, and hypertension. There's a question about that on page 9. If I repeat it, it's probably important. Emergency hormones, the morning after pill, needs to be taken within 72 hours and it's a one-time deal. Downsides to this mirror other hormones, nausea, heavy menstrual bleeding. That one's different, stomach pain and fatigue. Next, we have the patch. It's a hormone. Replace it once a week. Check it out. The same adverse effects. Know those. Thromboembolism can happen, and it's more common with the patch. Injections. There's a question about that on page 9. Those are given every 13 weeks, 4 times a year, basically. I like the number 13 because it's an unlucky number, 13 weeks. If you're unlucky with injecting hormones into your arm, this is what you get. Spotting, depression, weight gain, bone issues, keep up the calcium and vitamin D intake. There's a question about that on page 9. This is long-term stuff. Moving on to the vaginal ring. You gotta go in for a new one every month. Complications looking like those hormone complications again. Clots, hypertension, headache, weight gain, nausea, exciting, not. Okay, a surgical implant. Okay, On your inner arm, you get hormones being dispersed. This works for 3 years, gals, 3 years. Again, check out the hormone complications again. There's a question about that on page 9. All right, IUDs, intrauterine devices. You gotta go in monthly and check that string is hanging down. That means the thing hasn't moved. There's a question about that on page 9. An IUD works for 1 to 10 years, depending on if it's a copper or a hormonal IUD. Hormonal, 3 years, copper, 10. Remember, if you're dealing with hormones, know those adverse effects. If it's copper, no hormones, you might be dealing with vaginal infections here, so watch out for those. Transcervical sterilization, permanent. Scar tissue forms, those fallopian tubes are blocked, mama. You need to wait 3 months, that's 3 months after it's done, to check if the fallopian tubes are indeed blocked. Moving on to surgery, this is female sterilization or a bilateral tubal ligation. The tubes are cut, burned, or blocked. Irreversible. Male sterilization is a vasectomy. We are severing the vas deferens. If a man is undergoing this short, safe, simple procedure, he needs to ejaculate 20 times before he is clear. The doc will also collect sperm count to determine if all the sperm are clear. That's 20 ejaculations. Keep a notebook or something. All right, hormonal contraception adverse effects. Let's review. Chest pain, short of breath, leg pain, clots, headache, eye problems, stroke, nausea, breast tenderness, breakthrough bleeding, fluid retention, hunger, tiredness, depression, and hypertension. All right, here we go again. Chest pain, shortness of breath, leg pain, clots, headache, eye problems, stroke, nausea, breast tenderness, breakthrough bleeding, fluid retention, hunger, tiredness, depression, and hypertension.